Vikings are well known for their involvement in raids, battles and wars, so it was only fitting that they had good practical knowledge on how to manage and treat battle wounds. While they didn't have advanced medical technology or formal surgery, their methods were based on their understanding of anatomy, herbal medicine and basic techniques for dealing with trauma. They did understand the importance of stopping bleeding, cleaning wounds, preventing infection and immobilizing fractures, which are all essential in managing major trauma or wounds. So let's explore the techniques they used, compared to what we would do today for similar injuries. If you enjoy exploring medical practices throughout the different ages, then please subscribe to my channel, Doctor of the Ages. As mentioned, the Vikings knew that stopping the bleeding from a wound was crucial. We now know this is because uncontrolled blood loss can lead to shock, a life-threatening condition, which means that the body can't deliver enough oxygen to the vital organs. They likely used bandages made from cloth or leather to apply pressure to the wound and reduce the flow of blood. This is similar to our practice today. When faced with bleeding, we would apply direct pressure to the wound using a clean cloth or a tourniquet in cases of severe bleeding. Some herbs like yarrow and cabbage leaves were also used as part of the Vikings' first aid practices. They have natural astringent properties which help constrict blood vessels and reduce bleeding. In some cases, Vikings also use cauterization, which is the application of a hot metal object to stop severe bleeding. This technique was painful, but could be used as a last resort to prevent life-threatening blood loss. Nowadays, we would use electrocautery or chemical cautery to seal blood vessels and stop bleeding. Electrocautery is when a resistant metal wire probe is used to generate heat that coagulates tissue or cauterizes blood vessels. This is often used during surgery to stop bleeding. Chemical cautery is commonly used as well to manage nosebleeds. It involves using the chemical silver nitrate to bind to the tissues inside the nose to stop blood flow. But unfortunately, these methods were not available at that time, so they had to make do with old school cauterization. The Vikings had a good understanding of using herbs with antimicrobial properties, and they used these to clean wounds. We know that it is vital to keep open wounds clean in order to prevent complications like infection or sepsis. Yarrow was a common herb used to treat wounds because of its natural antiseptic and anti-inflammatory properties. Garlic and juniper berries were used for wound care as well, as they were also believed to have antimicrobial properties. In some cases, they might have used ash from a fire or other natural substances to clean wounds, as ashes have mild antiseptic qualities as well. The Vikings had access to herbs with natural analgesic or pain-relieving properties. Willow bark, which contains salicin, the precursor to aspirin, was a common remedy for pain and inflammation. It was used to reduce pain from injuries or surgical procedures like amputations or the setting of broken bones. Nettle was also used for inflammation and pain, and it could have been applied to reduce swelling around the injured areas. Another herb, comfrey, was likely used as a poultice to reduce swelling, ease pain, and promote bone and tissue healing. For bone fractures, the Vikings would have used splints made from wood or other available materials to set the bone and keep it immobilized. We know that it is important to immobilize the broken bones to prevent further damage to surrounding tissues. It also reduces pain, allowing the bone to heal properly by keeping the fractured ends aligned and stable. Evidence from Viking burials actually shows signs of healed fractures, indicating they knew how to apply splints and bandages effectively. Bones might also have been tied or bound with strips of leather, cloth, or even sinew to keep them in place while they healed. The Vikings were skilled in the use of these materials for both medical and practical purposes, such as when they made boats and clothing. In cases of severe injury, especially when limbs were crushed or severely infected, amputation may have been necessary. There is evidence from archaeological findings that Viking healers performed this surgery, as there have been Viking graves found with healed amputations. Evidence of another surgical procedure, trepanation, the process of removing part of the skull to treat head injuries or trauma, has also been found in Viking burial sites. So it seems that the Vikings had some knowledge of cranial surgery to relieve pressure from head wounds or to treat skull fractures. Vikings used tools like knives and scalpels for basic surgery to treat wounds or to perform amputations. Archaeological evidence has shown that Vikings had access to metal tools that could be used for these surgical procedures. Vikings recognized the importance of rest and recuperation as part of the healing process. They may have used teas or tinctures made from herbs like chamomile or lavender to help with relaxation and to promote sleep during the healing process. These herbs are known to have calming and soothing effects, which would also help individuals recover from the physical and emotional stress of battle. While battle wounds were treated externally, as we have discussed, nutrition also played a role in healing. The Viking diet included fish, meat, berries, roots, and fermented foods, all of which would have provided essential nutrients like vitamin C, important for wound healing, protein for tissue repair, and omega-3 fatty acids to reduce inflammation. So in conclusion, it seems that the Vikings certainly understood the fundamental aspects of managing trauma. The knowledge was based on experience, passed down through generations of healers, warriors, and individuals skilled in herbal remedies, and evidence has shown that their methods were actually remarkably effective for their time, and it allowed many Vikings to survive serious injuries and continue with their warrior lifestyle. So I hope you enjoyed this video and found it informative. If you did, please do like, share, and subscribe to my channel, Doctor of the Ages.